Hi, my name's Amit and I'm a paediatric consultant with an interest in epilepsy, and I've been sent a few questions by Young Epilepsy relating to coronavirus, the COVID-19 pandemic, and how it might impact on the management and the care of young people with epilepsy. So the first question is around whether epilepsy clinics are likely to be cancelled. I think it's possible that some routine appointments could be cancelled. I know some hospitals are having to do that and others haven't quite had to do that yet. If it is the case that your clinic is postponed or cancelled, your team will, I'm sure, provide you with a way to be able to contact them if you've got any queries or any questions in the interim. The next question is, can my clinics be made available virtually? Certainly that is something that different teams and services are trying to do, so yes is the answer. My own service has been doing it via telephone consultations, and that's been working really well. The next question is, how do I get in contact with my epilepsy team if I need to? When should I get in touch with them, and will they want to hear from me? I'm certain that your team will want to hear from you. It's how you get in contact with them will obviously depend on how your team works and what sort of things they've got set up. My own service has a service email and a service telephone line that we always check, and that usually works really well and has worked well through all of this. When should you get in touch with them? Well, again, if you've got any particular concerns or queries, they'll definitely want to hear from you. The next and the last two questions relate to medication, and of course that is always a source of worry for people when something like this is happening. But the specific question is, will the availability of my medication change? Will I still be able to get hold of it? And what happens if I can't? Well, I haven't seen any issues myself, and I haven't come across or been asked about any issues with medication supply. So hopefully that's reassuring in itself. But for particular cases, I would actually go to the people where you get your medication. So I would contact your pharmacist, your local pharmacy, and just check that there haven't been any issues in getting hold of medication. I think they're likely to be reassuring, just as I have stated there. But if not, you can have a conversation with them. Just make sure you do it well before your supply is due to run out. Of course, another part of that is getting your repeat prescription, and that would be via your GP usually, and will continue to be via your GP even during this time. They may just have a different arrangement that they put in place. So if your pharmacist doesn't already know that system, but in many cases they will, then you can obviously contact your GP for a little bit more detail on that. And that's all the questions I was asked to answer, so I hope that's provided some reassurance.